Hi, today I'm going to be talking about croup. What is it? It's a viral infection of the larynx and trachea, which is your voice box and the airway. And the most common virus that does it is parainfluenza virus. And what the virus does is when it infects your voice box and the airway, it causes some swelling and inflammation of that voice box. And that is the reason why you see that hoarseness of voice. And you know how in adults you get what we call laryngitis and you kind of lose your voice. So in children, that swelling and inflammation of that airway, it gets narrow, and that's what causes that hoarse, barky, croupy cough. And then it also leads to the stridor, which we will talk about later. So the clinical features is it starts as a cold, cough, congestion, runny nose, fever, and then followed by the hoarse, sparky cough, which is very recognizable. And then in severe cases, if the narrowing of that airway is severe enough where the normal airway may be this big, and then it becomes, narrower, so then the air that is going in and out of there causes that noise to be formed. So that's what's called stridor. And the more severe the case, you'll have more and more of this stridor. So even while sitting in mom's lap, the child may be having stridor. So some of the things that are done for croup is in the hospital would be giving steroids like Decadron, and then nebulized breathing treatments such as racemic epinephrine, and they both do the same thing, which is to minimize that swelling and inflammation of that airway so that your respiratory distress is less, and that stridor or that trouble breathing, that becomes better. Otherwise, most children will just get better on their own. It's a self-limited illness, it's a viral infection, so there's no antibiotics, and they do get better on their own. However, if they do have respiratory distress, they have trouble breathing, or if they're having this stridor, which is that noisy breathing, then you need to go into the emergency room for further treatment. And the time of the night is usually from 10 p.m. till 4 a.m. is when croup tends to get worse. And the age group is typically 6 months to 3 years. These are the children who most likely get croup. So again, take-home points is a croup. It's a viral infection. Time to head to the ER is if your child has stridor at rest and severe respiratory distress. And yeah, I hope that helps. Thank you.